Welcome to Lesson 8, Lay Terms and Definitions. In this lesson, we practice changing technical medical language into plain English that a patient can understand. The full original page stays on the left of the screen. The yellow highlight marks the exact row or sentence being explained. On the right, you will see the medical term, the simple lay term or definition, and a complete Arabic translation written from right to left. I will speak slowly in English only. Please use the Arabic text on screen to check the meaning. The introductory paragraph gives an important rule. Explanations should be given in words that the patient will understand, while avoiding medical jargon. Medical jargon means difficult technical words used by healthcare professionals. Lay terms are words familiar to people without medical knowledge. They help patients understand information, instructions, diagnoses, and treatments. This is not about making the information less accurate. It is about choosing a clear phrase first, then adding the medical term if it is useful. For example, a clinician may say myocardial infarction in a report, but may explain to a patient that this means a heart attack. We will study 3 groups today: medical conditions, medication, and simple definitions for body parts and common medical words. Read every Arabic translation while you listen, and pause whenever you need extra time. Let us begin with lay terms for medical conditions. The first row is acute cerebrovascular event. This technical expression means a sudden problem with blood flow in the brain. The lay term is stroke. In Arabic, both the medical meaning and the simple patient word are shown on screen. When speaking to a patient, stroke is usually the clearer first word. The second row is arrhythmia. An arrhythmia is an abnormal heart rhythm. The lay term is palpitations. Palpitations are the feeling that the heart is beating quickly, strongly, irregularly, or in an unusual way. Notice that the technical term describes the rhythm itself, while the lay term describes what a patient feels. The third row is dyspnea. Dyspnea is the medical term for difficult or uncomfortable breathing. The lay term is breathlessness. A patient may say, "I feel breathless," or "I get breathless when I walk." This is clearer than asking whether the patient has dyspnea. Quick check. Which simple word would you use for dyspnea? The answer is breathlessness. The question and its Arabic translation are on screen. Say the full pattern slowly. Dyspnea means breathlessness. These 3 examples show the main purpose of this appendix. Use a word the patient knows, then make sure the patient understands what you mean. The next medical condition is fractured neck of femur. This is a fracture near the top of the thigh bone, close to the hip joint. The lay term is broken hip. Broken hip is shorter and is easier for a patient or family member to understand quickly. Next is hematemesis. Hematemesis means vomiting blood. It is important to explain this in plain English because it may describe a serious symptom. The patient phrase is vomiting blood. Do not use a long technical word if the simple phrase communicates the problem immediately. The next row is hematuria. Hematuria means blood in the urine. Urine is the liquid waste that leaves the body when a person passes water. The patient may say, "There is blood in my urine." The next condition is insomnia. Insomnia means trouble with sleeping. The lay term is not just no sleep, it includes difficulty falling asleep, difficulty staying asleep, or waking too early. The final row in this group is intermittent claudication. This means pain in the legs caused by reduced blood flow during walking. The lay explanation on the page is pains in the back of the legs when walking. Intermittent means that it comes and goes. Claudication is a technical word, so the patient-friendly description is especially useful. Quick check. What simple phrase explains hematuria? The answer is blood in the urine. Read the Arabic translation on screen before we continue. We will finish the first table with myocardial infarction and nocturia. Myocardial infarction is the technical name for a heart attack. Myocardial means related to the heart muscle, and infarction means damage caused when blood flow is blocked. In patient language, say heart attack. The phrase is direct, familiar, and clear. The last condition is nocturia. Nocturia means needing to pass urine or water at night. The simple explanation tells the patient exactly what the term describes, waking or needing to urinate during the night. It is useful to ask, do you need to pass urine at night? Rather than asking only, do you have nocturia? Let us review the condition table. Use stroke for acute cerebrovascular event. Use palpitations for arrhythmia. Use breathlessness for dyspnea. Use broken hip for fractured neck of femur. Say vomiting blood for hematemesis and blood in the urine for hematuria. Use trouble with sleeping for insomnia and pains in the back of the legs when walking for intermittent claudication. Finally, use heart attack for myocardial infarction and needing to pass urine at night for nocturia. Review question. Which lay term means heart attack? The answer is myocardial infarction as the medical term and heart attack as the lay term. Both the question and the answer are translated into Arabic on screen. Now look at the second table, some lay terms for medication. The first medicine is analgesics. Analgesics are medicines that reduce pain. The lay term is painkillers. This is a common patient word, although in formal communication we may also say pain relief medicine. Next are antidepressants. These are medicines used to treat depression and sometimes other conditions. The simple explanation is tablets to improve your mood. This phrase is easier for a patient to understand, but a clinician should still explain the purpose and possible effects of the medicine carefully. The third row is anti-inflammatories. These are medicines that reduce inflammation, pain, or swelling. The lay explanation is medicine to reduce swelling. Inflammation can cause swelling, heat, pain, and redness, so reducing swelling is a useful, simple description. The fourth row is bronchodilator. A bronchodilator is a medicine or substance that opens the airways in the lungs. The lay definition is a substance which causes the airways to open up. Airways are the tubes that carry air into and out of the lungs. When we explain a bronchodilator, it is often helpful to add that it can make breathing easier. Quick check. Which medicine is described as something that opens the airways? The answer is a bronchodilator. Read the Arabic question and answer on screen. The next medication term is DMARDs, which stands for disease-modifying anti-rheumatic drugs. This is a long technical name. The lay explanation is pills that help stop arthritis progressing. Arthritis is inflammation or damage in the joints. Progressing means becoming worse over time. The simple explanation helps a patient understand the purpose of long-term treatment. Next are diuretics. The lay term is water tablets. Diuretics help the body remove extra water by making a person pass more urine. Hypertension medication means pills for blood pressure. Hypertension is the medical term for high blood pressure. Hypnotics are sleeping tablets. They are medicines that can help a person sleep, but they must be used carefully and exactly as prescribed. Oral contraceptives are called the pill. These are tablets used to prevent pregnancy. Let us review the medication table. Analgesics are painkillers. Antidepressants are tablets to improve your mood. Anti-inflammatories are medicine to reduce swelling. A bronchodilator opens the airways. DMARDs help stop arthritis progressing. Diuretics are water tablets. Hypertension medication means pills for blood pressure. Hypnotics are sleeping tablets.
Oral contraceptives are the pill. Review question. What is the lay term for diuretics? The answer is water tablets. The English question and the complete Arabic translation are on screen.
We will now read the English explanations for the first 4 terms in the third table. The Arabic translation remains on screen, so you can read the meaning while listening. First, arteries are tubes which carry blood around the body. In simple language, arteries are blood vessels that take blood away from the heart. They carry oxygen-rich blood to many parts of the body. Next, benign means not due to cancer or infection. When a doctor says that a growth is benign, it is not cancer, although it may still need medical attention or follow-up. Next, bronchi are airways that connect the windpipe to the lungs. The windpipe is also called the trachea. The bronchi are passages that carry air from the windpipe into the lungs. Next, cholesterol is fat that clogs the arteries. This is a simple explanation. More exactly, too much cholesterol can build up in artery walls and reduce blood flow. Read the Arabic translation of each complete definition on screen. These 4 entries show how a technical body word can be explained clearly in everyday English. We will now read the English explanations for the final 5 terms in the third table. First, intervertebral discs are shock absorbers which separate the bones in your back. They sit between the vertebrae, or bones of the spine, and help the back move and absorb pressure. Next, the esophagus is the tube that connects the back of the throat to the stomach. Food travels through this tube when you swallow. Next, the pancreas is a gland that helps digestion and makes insulin to control blood sugar. Insulin helps move sugar from the blood into the body's cells. Next, the thyroid is a gland that produces some of the hormones required in daily life. These hormones affect many body functions, including energy and metabolism. The final term is urethra. The urethra is the tube which carries urine from the bladder to the outside of the body. Remember the main lesson from this page. Use accurate medical terms in records when needed, but explain them to a patient in plain English. Keep the explanation short, kind, and clear.